Okay, welcome everyone. This is Dr. Guru Prasad, Neonatologist, faculty for NEET Super Specialty Pediatric Division. So, like every year, we are conducting interviews of toppers this year also. The main motto of this interview is to sensitize all the upcoming pediatricians on their preparation strategy and tips and tricks and how to write the exam. All these things directly we will hear from the toppers. And I feel proud to introduce to you Dr. Saurabh, who is our student for the past 1 year. And he is one of the most talented student I have ever met till now. Actually, I thought he will be in the top 10, but however, he got rank 58 with score of 401, which is decent. But still, I feel he must have got in the top 10. Anyhow, we will talk to him and learn from him how is his preparation strategy and all. Okay, welcome, Dr. Saurabh.
Thanks a lot, sir. Thanks a lot for such a nice appreciation of words which you have been used to describe me, sir. Thanks a lot.
Okay. What is your feeling right now?
I must say it is, I'm very happy, sir. And it has been a result of a lot of hard work and a guidance in the past shown by all my teachers and sir, you, sir, which has helped me.
Okay, great. To all the viewers, can you introduce yourself? Like, where did you do your MBBS, MD? What were you doing for the past 1 year?
Yes. Sir, I had done my MBBS from Andhra Medical College, Karnataka. And then I had done my post-graduation 2018 in JNMC, Belgaum, Karnataka. Last year, I had completed my MD. And after that, I had joined in as a SR in Child PGI in Noida, sir. After joining for a few months, and I realized that I should prepare for super specialty exams. And after that, I was more focused and had left the SRSIF so that I can focus more for the preparations.
Okay, great. Like, what was your preparation strategy? Many people ask, no, like what books you are reading, like that.
So first, sir, is Ted Nelson, sir. Or the first, you can go systemic chapters wise Nelson, sir. So suppose nephrology, neurology, hepatology, gastroenterology, and after that, sir, for neonatology aspect, AIMS and NICU protocols, and even the sir Cloherty few chapters I had gone through, sir.
Okay, and like how many hours you were preparing per day before the exam?
Sir, it has gradually increased. I must say, in the starting, it is difficult to sit. It is like starting. It used to be 2 or 3 hours, sir. But later on, it has increased, and before exams, so nearing to exams, it reached to 10 hours, or some days and more than 10 hours also, sir.
Okay, great. So during this time, did you ever feel like giving up, or what kept motivating you for this thing?
So I must say, I felt many times of not giving up such, but feeling depressed or demotivated at certain times, because at this juncture of life, there are many other things which come into the play. And I used to motivate myself as there was just self-motivation that I need to do it for myself, for my parents, and why I had started this journey. And sometimes I used to see some videos as such of the certain past interview of the toppers, which used to help, sir, because in many interviews we have gone through this question, and it is definitely a part of preparation, sir. We can't always be motivated, but yeah, we have to be persistent. That is the more important, sir. And we have to believe. So we have to have certain faith, sir, on ourselves and on the gods.
Okay, great. Like, what was your exam strategy? Like, how many questions you attempted? Like, what suggestion you would like to give to a student who is going to write the exam? Like how many options? If he is not sure, should he leave the question, or how can he attempt like that?
Sir, I had attempted 149 questions, sir.
And why did you leave that one question?
So that one question was that time period for which the maximum time period which can be which is which is the limiting factor for the examination for a rape victim, sir. I don't know. I was between, so there were a few questions in which definitely, sir, we should go for a question in which we are in a doubt between two options. Yeah, there were a few questions which I was not knowing, and I had attempted, sir, because in these exams, what I felt, it is better to go for more questions to be attempted. I don't know I was right or not, but apart from that, the most of the questions which I had attempted, I was trying to segregate at least two options, sir, and then to mark whichever option I was feeling correct.
Okay. Anyhow, okay, you have done it. You have cracked the exam. So, like, how did ADR plexus help you?
Sir, as ADR plexus, sir, after completing the topics, like suppose first I had joined neonatology, ADR plexus neonatology mocks. There were 7 mocks, sir. 6 were of neonatology and 1 was from biostats and ventilation, sir. So what I felt, and it is first of all very important tool for revision, and it covers most of the important topics, which although we have read, we had just gone through, or we didn't consider that line to be so important that then that paragraph itself or certain pictures to be framed as a question. And I must say, sir, your ventilation, which you had taught in around 40-45 minutes, it's more than enough, sir. For if you are planning for any sentence, INESS, it is a must, and even for NEET-SS, the questions came from that 30-40 minutes of video as such. And later on, after INESS, I had joined Nelson Rapido also, sir. So once I finished my one reading, and then I had given the first mock test. And after that, I came to know that there are certain topics which are more important, which is must to be revised. Like it is like which topics are more important, in which systems to be revised. It has helped in that. And definitely, sir, in mock test there were a lot of image-based questions directly from the Nelson. Like in mock test, first only there was a image from central incisor session of the growth hormone deficiency, and which like those images had come this time in the exam. And I must say that this has helped, because sometimes we feel not like study. We can even see the Nelson pictures, and like many pictures, around 15 to 20 pictures had come this time, sir. And I had seen those images and the Q bank like scenario in the area plexus mock, sir, I must say, and it has helped a lot, sir.
Great. Like
even the lesion syphilis and the season syphilis picture was exact.
Yeah, it was there. Okay, how many do you think roughly out of 150 you got directly or indirectly from those topics from what we have learned in the exam?
So from if you combine all the 5 mock tests and all the important topics, I think nearly more than 70%, sir. And it was more than 70% definitely.
Yeah, definitely. Our motto is also the same. We didn't want to spoon feed every topic. Our motto is short and crisp. 5 mocks, revise all the important topics, no repetition of questions again. So from one question, you revise all the topic. Our motto is that one only. We didn't want to teach thousands of hours of videos, and a student doesn't get a time for a last minute revision, I feel.
Right.
So we felt like we followed Pareto rule. You know what is Pareto rule? Pareto rule is like 80% of the problems are due to 20% of the issues. See, if there are 100 problems, out of that 80 are because of some 20 issues only. If you catch hold of the 20 issues, no, you can cover this 80%. That is a smart strategy. No one can cover 100%. No one can teach 100%. But if you can cover 80% at least, no, that's all. No, even a topper cannot score 150 out of 150, right?
Right. Sir.
You can score some 138 or 135 at the max. That's all. So we targeted only that thing. I think that is how it worked also. Next is like what advice you would like to give to your colleagues, like fellow PGs who are just joined pediatrics, and those who have completed pediatrics and are doing senior residency or working in some private setup. Any suggestion, tips and suggestions you want to give?
Yes, for those who have joined and sir, as a postgraduate, says it's better to start as early as possible, sir, I must say. And the focus should be primarily on the Nelson, sir. In the starting first year, second year, what cases, or then NICU and PICU, whatever cases we are seeing, just to read that topic completely. Even though try to read at least 10 minutes, if not complete the whole topic in a day, that will help somewhere when after the 3 years, or when by that time we'll reach to the exams. At least 10 minutes per day of the study will also help somewhere. And those who have completed, those who have joined somewhere, sir, it's definitely because I myself have started preparation while I was doing SRship. So the most important is the initiation, sir. If we have thought that yes, we should do it, we should the first step is the most important step. We should take it. We can do it if we have thought yes, obviously we can. So first is to start the preparation, even though how much less it is, 1 hour or 30 minutes or 2 hours, and gradually as it increases, you should then think over. If possible, it's always, as you also suggested me, sir, I had talked to you over phone. You had also suggested me it's better to give last 3-4 months of a time, especially for the preparations, sir. So it's always better to start initially as much as we can, and it can be done. It's not like it is something which is out of the Nelson, or we know our basics. We are MD pediatricians, so it can be done. It's just like we have to have a belief, have some guidance, have some hope, sir, and gradually it will happen, sir.
Okay. So very wonderfully said. So final question before I end it: what is your branch of interest and which college you are thinking about to join?
So any specific branch I haven't decided till now, sir. And definitely I will seek your opinion and advices, sir. And I would, my MD and MBBS had been in South, sir, in Karnataka for 10 years. I am basically from Uttar Pradesh. So I would like to be this time in North. Hopefully, I would be able to be in some place in the North, so I would try.
Okay. Anyhow, you asked my suggestion. What I suggest you is continue your preparation, write INSS and crack in one of AIMS or PGI. That would be a better one. Okay. Hope you will get your branch of interest in North India preferably, and stay in touch and keep motivating all others also. Thank you.
Thank you. So one more point, sir, I wanted to say, sir. Yeah. Regarding, sir, the way you used to teach, and especially, sir, in that way you used to simplify the topics, because I still remember you were teaching IEM and specific orders of the IEMs. You had made us draw multiple cats, and you had made us draw tires with the cabbage history of aerosynemia. All these small diagrams, sir, has got implemented, sir. It is like imprinted in the mind, sir, and it is for life. I just wanted to, I know it is at the end, but it is, it came from my, sir, so I just wanted to say it, sir. So thanks a lot, sir, for all these minute things which has helped me a lot, sir.
So see, these things, what I learned from my seniors and what I learned myself, sometimes you have to remember there is no other option. So I felt images are best way to remember rather than mugging up. There is always the confusion. So I'll try to make images as many as possible and remember. That is what, that is the way I learned. I thought I will teach the students in the same way. Okay, thank you for that. Okay, all the best to you.
Thank you, sir. Thanks.